Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Okay, we have International Neuroblastoma Staging System. According to International Neuroblastoma Staging System, we have four stages. Stage 1. Stage 1 is presence of localized tumor with complete gross extension. This is stage 1 where there is localized tumor. In the kidney there is a tumor and we have completely excised it. Okay, this is done after excision. You will see that there is presence of residual disease. It is excised with or without residual microscopic disease, and the ipsilateral lymph nodes which are there, they are actually negative for tumor. Okay, the ipsilateral lymph nodes are also negative for the tumor, and these nodes which are attached to or removed with the primary nodes may be positive. See, if the ipsilateral lymph nodes which are attached to the tumor may be positive, but representative ipsilateral lymph nodes are negative. Representative ipsilateral lymph nodes are actually negative, but if any lymph nodes or if anything is attached to the primary tumor, then it is positive, except them all the others are negative. Then that is localized tumor with complete gross extension, which is stage 1. Then we have stage 2. Stage 2 is again two types, stage 2A and stage 2B. In stage 2A, there is localized tumor with incomplete gross excision. So this is the tumor. It is not completely excised, only a part of it is excised, okay, with incomplete excision. So the representative ipsilateral non-adherent lymph nodes are surgically negative for the tumor. So for the tumor, these are negative. Okay, again this is lymph nodes are negative in 2A. Then we have 2B. In 2B, there is a localized tumor is present with or without gross extension, but ipsilateral adherent lymph nodes are seen. That means if this is the gland, if this is the kidney, and this is the adrenal gland, and this is the tumor, now this tumor has adherent lymph nodes also which are adhered to it. So this adherent lymph nodes to the tumor is actually 2B, where there is ipsilateral, sorry, non-adherent. These other non-adhered lymph nodes are also positive for the tumor. So this is stage 2B. Then we have stage 3. In stage 3, it is actually completely unresectable unilateral tumor. There is unresectable unilateral tumor. Contralateral regional lymph node involvement is seen with bilateral extension by infiltration or lymph node involvement. Actually, this is the kidney. This is the adrenal gland. So here there is an unresectable tumor is present here. Along with that, contralateral lymph nodes are positive, and these tumors may be midline tumors, or there can be bilateral extension can be present. So this is stage 3. Then we have stage 4. Stage 4 is actually any primary tumor with dissemination to the distant lymph nodes. Anything with distant lymph nodes dissemination or metastasis to bone marrow, bone, liver, skin and other organs is stage 4. Then we have stage 4S. In stage 4S, it is actually a localized primary tumor. So it is a localized primary tumor with dissemination to skin, liver and bone marrow. If there is localized primary tumor with dissemination with only which is only limited to skin, liver and bone marrow, that is it has spread to skin, liver and bone marrow in an infant less than 1 year, is given 4S.
thank you and thank you for watching.